And then the third bucket that I often think about is immunotherapy-based type approaches. And when we say immunotherapy, what we're really talking about are drug approaches that activate the patient's immune system to attack the tumor, and that the basis of the tumor's regressing or shrinking is based upon an immune response to that tumor. How do we reinvigorate that? This has really been an effective approach for many cancers that we treat, and have really shifted the paradigms that in the ways that we treat a lot of different tumors. Unfortunately, for salivary gland cancers and specifically for ACC, the trials to date have really not demonstrated really good benefits. So we and others have done clinical trials using different immunotherapy approaches that at this point have not really been very effective. So the thrust of that research program is really trying to understand why ACC tumors don't respond as well, and trying to develop novel immunotherapy approaches for those patients. And if there's opportunities, whether in phase 1 clinical trials or et cetera, to try new immunotherapeutic approaches, and they allow ACC patients to go on, or they're interested in accruing ACC patients, those of course would also be of value. And then the last part I would say is, in these patients where we're developing clinical trials for incurable disease, or trying to give chemotherapy or other oral drugs that treat that disease, because these treatments are not necessarily treatments that cure patients, the most important thing is making sure that we have as many drug options at our disposal. So that means what can we glean from the existing literature to say what drugs would be reasonable to use? What can we glean from the patient's genetic report to nominate new drug directions? And of course, continue our efforts to develop ACC-directed clinical trials for patients. And so, you know, I think this is where it's really important to be sure that you're at an institution with a specific ACC focus and research program that can help guide and direct these patients to the right treatment options. So thank you for your attention.